A quorum is present. The hearing of the House Committee on Education and Labor, Subcommittee on Healthy Families, and Communities of Improving Child Nutrition Programs to Reduce Childhood Obesity will come to order. Before we begin, I think I heard one of our young ladies talking about it. Make sure all cells and Blackberries are on vibrate or quiet. I appreciate that. I now recognize myself, followed by Ranking Member Todd Platts from Pennsylvania for an opening statement. I'd like to welcome our witnesses to this hearing on how we can reduce childhood obesity through the Child Nutrition Reauthorization. As a nurse for over 30 years, I have seen firsthand the risks of illness that can result from obesity. In the last several months, I have read the studies that 1 in 5 4-year-olds are obese, that kids have the arteries of middle-aged adults, and that the number of children who take medication for chronic diseases has jumped dramatically. In March, a study was released which indicated that proximity to fast food is a factor in student obesity. Some of these reports are shocking, and unfortunately, some are not. Childhood obesity, diabetes, and heart disease are all on the rise in the United States, and one of the best tools that we have to combat these illnesses is our ability to provide wholesome and healthy nutrition to children in school. Childhood obesity is found in all 50 states, in both young children and adolescents, affecting all social and economical levels. Low-income communities tend to have the highest obesity rate due to factors such as lack of access to affordable healthy foods, lack of safe, available venues for physical activity, and a lack of education about nutrition and its benefits. Furthermore, it has been found that minority children are at the greatest risk for obesity. There is no silver bullet to solve childhood obesity. However, the school breakfast and lunch programs can make a great impact because they provide more than 50% of a student's food and nutrition intake on school days. The decisions we are making during reauthorization are very important to a great number of children, and that is why we have assembled such a knowledgeable panel. We were here today to explore how we can reduce obesity through the Child Nutrition Reauthorization. There is a wealth of information available on the issue of reducing obesity, and in my mind, it comes down to two things: healthy eating and physical activity. These sound simple, but families all over the nation know it's far from simple. Given the current harsh financial realities for many families in my district and throughout the nation, schools have an increasingly important role to play in improving children with nutritious food during their days at school. I also hear from folks in schools finding it more and more difficult to meet the increased demand of meals with healthy, nutritious, and high-quality foods without adequate funding. We also know how critical it is to reach the youngest children and infants as soon as possible. I hear from constituents that all the time how important the WIC programs are to help families transition from poor eating habits to healthy habits. This is particularly important because WIC is working with the youngest of our children. As we will hear about today, the Institute of Medicine has undertaken a study to review and provide recommendations to update the nutrition and meal standards for school nutrition programs. School meals standards are critical, and I appreciate Dr. Stallings being here to discuss her work. Of course, children aren't just eating school meals when they're at school. Foods in vending machines and less healthy, a la carte items in the cafeteria are readily available. And while in school, many children are subject to junk food advertisements. The students are a captive audience, and advertisers have proven to be remarkably effective at influencing their target customers. Representative Woolsey has done a lot of work in this area, and I'm looking forward to her testimony regarding issues surrounding competitive foods. Finally, as I mentioned earlier, in addition to healthy foods, physical activity is the other critical element in reducing obesity. We know that change for adults is hard, but if we start to educate our children early enough, we can establish lifelong habits and the values of healthy living and wellness for the future. We also know that studies show children who are physically inactive learn better. We will hear testimony today about some terrific and innovative programs schools are using to address obesity. We have our work cut out for us, but by taking a comprehensive approach to nutrition, our children, families, and communities will all be healthier. I want to thank all of you for being here, and I look forward to your testimony. I now recognize the distinguished gentleman from Pennsylvania, Ranking Member Platts, for his opening statement.
Thank you, Madam Chair. In the interest of time, with knowing we may have votes soon and with two of our colleagues waiting, you well captured the importance of this hearing and the importance of this issue in the broad sense. So I will submit my statement for the record and look forward to the testimony of our colleagues.
Pursuant to Rule Committee 7C, any member may submit an opening statement in writing at this time, which will be made part of the permanent record. Without objection, all members will have 14 days to submit additional materials or questions for the hearing record. I would like to briefly introduce our very distinguished panel of witnesses here with us this morning. The complete bios of the witnesses will be inserted into the record. Today we will hear from two panels. On our first panel, we will hear from two members of Congress, my colleagues and fellow members of the Committee in Education and Labor, the Honorable Lynn Woolsey from California and the Honorable Mike Castle from Delaware. On the second panel, we will hear from six witnesses: First Lady Michele Paterson of my home state of New York, Dr. Virginia Stallings, an expert on child nutrition issues, Ms. Nancy Copperman, who runs an obesity prevention program on Long Island, Mr. Felton at the National School Boards Association to discuss nutrition and standards, Ms. Susie Byrnes, founder of the Susie P. Byrnes Health Educational Center, and Dr. Richard of Dr. Robert C. and Veronica Atkins Center for Weight and Health College on Natural Resources. I thank you all for being here. In the interest of time, given the large number of witnesses today, I will make my formal introductions short. First, I would like to introduce our first panel. The Honorable Lynn Woolsey from California and Mike Castle of Delaware have both been in Congress since 1993, and I've served with them on the Committee of Education and Labor since I came to Congress. Ms. Woolsey serves as the chairwoman of the Subcommittee on Public Works Protection. Do you want to?
Thank you, Madam Chair. And Mr. Castle is a ranking member of the Education and Labor Subcommittee on Childhood, Elementary, and Secondary Education. He has a distinguished public service career. Actually, Mike, I was learning for the first time all the offices you held, and delighted: Deputy Attorney General, State Legislator, Lieutenant Governor, and two-term former Governor of the state of Delaware, and makes up the entire House delegation of the state of Delaware here in Congress. So we're delighted to have you and Lynn with us and look forward to your testimony. Thank you, Madam Chair.
Representative Woolsey and Representative Castle have each used their voices as members of Congress to call for action in areas where they're deeply passionate. They care deeply about the health and wellness of our youth, and I look forward to hearing their testimony on how to fight childhood obesity. Obviously, both of the members understand the light system and the 5-minute time limit, so let's get started. I thank you for taking the time out of what is an extremely busy day here in Congress to address this subcommittee. Ms. Woolsey?
Thank you, Madam Chairwoman and Congressman Platts, members of the committee. Thank you for the opportunity to testify before you today on today's hearing on childhood obesity. Our schools have a very powerful impact on the way our children eat and the lessons they learn about healthy living. With WIC and child nutrition programs set to be reauthorized this year, we have an opportunity to actually take bold steps to reverse these dangerous trends. I commend the subcommittee for holding this important hearing, and I commend you for your continued attention to the health and well-being of our nation's children. Children spend more than 1/3 of their young lives at school, including before and after school, and oftentimes holidays as well. So it's important that schools provide healthy foods throughout the entire school day. Unfortunately, current nutrition standards for foods sold at school but outside of the school meal programs are inconsistent, and they are often unhealthy. For example, donuts are allowed in vending machines, but lollipops are not. Cookies are fine, but breath mints are banned. These standards don't make any sense. They haven't been updated since my children were in school in the 1970s. And today, my grandchildren who are in school are faced with the same junk food choices that should have been replaced years and years ago. No wonder, Madam Chairwoman, that child obesity is becoming an epidemic. Today, 23 million children and adolescents are obese or overweight. Obesity rates for children between 6 and 11 years old have more than quadrupled over the last 40 years. Throughout their lives, these children are at greater risk for heart disease, type 2 diabetes, stroke, cancer, and social and psychological problems. That's why I've reintroduced H.R. 1324, the Child Nutrition Promotion and School Lunch Protection Act, which will ensure that all foods sold in schools during the entire school day are based on current scientific and sound nutrition standards. In the Senate, Democrat Senator Tom Harkins and Republican Senator Lisa Murkowski have introduced the companion to this bipartisan bill in the House. And this bill has been endorsed by more than 80 organizations, including a wide range of school health and nutrition advocacy groups. While critics might expect that schools that switch to selling healthier foods might lose money, it turns out to be just the opposite. According to a study conducted by the U.S. Department of Agriculture and the Center for Disease Control, the majority of schools switching to healthier competitive foods in their vending machines and a la carte lines actually increased their revenues. The Center for Weight and Health at UC Berkeley in 2007 also found that 65% of schools that had total revenue, that provided these better meals and better choices, had total revenue increases of more than 5% after switching, and providing then schools with improved nutrition standards that and also increase their revenues. H.R. 1324 would require that nutrition standards for foods sold in vending machines and a la carte lines meet standards for caloric intake, saturated fats, trans fats, and refined sugars. The bill would depend on leading scientific experts to make recommendations and would study the relationship between certain foods and obesity. Additionally, while H.R. 1324 would set strong nationwide minimum standards, states could go above and beyond those standards. It's obviously long past time to bring these schools, Madam Chairwoman, into the 21st century. Unless Congress updates these standards, students will continue to spend money on unhealthy options that undermine their health and their futures. So I look forward to working with the committee to get these changes signed into law. And again, Madam Chairwoman, thank you very much for having me today.
Thank you, Ms. Woolsey, for that information. Representative Castle.
Thank you, Madam Chairwoman. Thank you, Mr. Platts, and other members of the committee. And I thank Lynn Woolsey. We've worked together on this issue almost since we've been in Congress, I think. And hopefully it's at least working to a degree, but I think we can improve it, as Lynn has very well pointed out. Child nutrition programs are of vital significance to the future of the children in our country. We're all aware of the basic facts. Kids are not eating enough fruits and vegetables. They're not getting enough exercise. They're inside too much. There may be a lot of reasons for this, but the bottom line is there is an overweight issue among our children, and CDC data shows that approximately 17% of children and adolescents are overweight. Our statistics in Delaware are even higher than that. And in just 2 decades, the number of overweight and obese young Americans has tripled. And one of the direct effects of this has been diseases and conditions associated with adults are now being associated with children. Type 2 diabetes, high cholesterol, high blood pressure, which did not used to happen, but happens on a regular basis at this time. It sort of reminds me, I was just sitting here thinking when Lynn was speaking, of the ads you see on TV for people who've lost weight or whatever. I've never seen an ad for people who've gained weight saying what a wonderful thing this is, I feel so much better, or whatever it may be. I mean, the bottom line is that just from a social point of view as well as a physical health point of view and maybe mental health, we need to worry about this particular issue. The legislation which we've passed in the past and reauthorizing this, and this new legislation is a vital significance. In 2004, we did pass and sign, and the President signed the law, the Child Nutrition and WIC Reauthorization Act. In addition to other steps, the law put in place several comprehensive solutions to address the childhood obesity epidemic. Nutritional education, which I think is of vital significance, increased physical activity, efforts to combat hunger and food insecurity. Included was a provision I authored to require school districts to establish local school wellness policies. I might point out, Madam Chairwoman, also, kids often can educate adults, I've learned, in many of these areas, seat belts, for example, and in this area as well, which is not insignificant either. Under the school wellness policies, the school districts are required to establish policies that include nutritional guidelines, nutrition education, physical activity goals, and school-based wellness activities to encourage the development and implementation of programs to promote healthy eating and increase physical activity among children. School districts were tasked with developing these plans to accommodate a variety of demographics, economic situations, and local food preferences. Policies were required to be developed and implemented for 2006-2007 school year by school districts. School districts developed these plans in an attempt to accommodate a variety of different backgrounds, and resulting from these policies, we have nutrition programs offering healthier options, increased visibility of school nutrition programs, changes in behaviors, and more healthy choices being made by students. So one emphasis I'd like to make, and I don't know if we are addressing it in legislation or some of the speakers to follow us will address it, but I use the word options, healthier options. I still go to schools, well, and a couple years ago I went to a school that had all the options. They were serving broccoli or whatever, but one of the options was pizza. And I asked the people in the cafeteria about that, and they said, well, most of the kids are taking the pizza. It may not be pizza, it may be donuts for breakfast or whatever it may be, but the options need to be carefully crafted as well. You can't just offer them and say we've accommodated. You need to make sure that is what the kids are eating, and I think we need to pay a little more attention to what some of the options are. In Delaware, each of our wellness plans is reflective of the district's policies and views of how to best provide and maintain a healthy and safe learning environment. And all that, of course, is well and good, and they are doing that, and I've seen it, and they're working to promote the integration of nutrition education to all curriculum areas in K through 12. I think that's important, too, that people understand why these decisions are being made. Limiting portion sizes of snacks and beverages served in school, which is important, and limiting food being used as rewards, which can be difficult for teachers and parents sometimes, but is also important. In certain of our districts, for example, in the Laurel Middle School, music is played after lunch to encourage physical activity, and at the Austin D. Boss Elementary School in Wilmington area, Red Clay School District, hip-hop pageant program is put on to encourage physical activity. Many schools are implementing successful policies, but there are challenges. Strong school leadership is needed. When you find superintendents and principals and teachers who enforce it, it makes a difference. We need a commitment to enhancing school nutrition and wellness policies as implementation continues, and we need the support and knowledge of communities and families, which is essential to ensure wellness plans extend beyond the school days. We're fortunate to have the Nemours operation in Delaware working in this area to promote healthy lifestyles in all places that children live, learn, and play. Unfortunately, Nemours, by the will of Mr. DuPont, is only in Florida and Delaware, but they make a vast difference in terms of these programs. As we move forward with reauthorization of child nutrition legislation, we must work at the federal, state, and local levels to address this important issue and complex issue. We have to strengthen local wellness policy legislative language to ensure all schools and students benefit from plans. We have to target those with greatest risk. We need to support programs under current law that promote nutrition, education, and physical activity, and we need to meet the financial commitment to see programs through from start to finish. I appreciate the opportunity of being here, and I look forward to what this committee will be doing. I'll go back.
I thank my colleagues for their information and taking the time out on an extremely busy day to be here. I hope that when we get this legislation through, which I think we will, maybe we should start working on the members of Congress on the choices of food that we have here. Thank you very much. the debate that's been up here, apparently we've been notified when the votes start. There are going to be several votes, which unfortunately is going to take an awful lot of time. But we believe that we should start, so if the witnesses could come and sit at the table, we will start with the introductions. I want to thank you all for being here. And I now yield to Representative Tonkin of New York to introduce the First Lady of New York, Michele Paterson.
Thank you, Madam Chair. It is my pleasure to introduce our first guest at the second panel. It has been with distinction that our First Lady, Michele Page Paterson, has served New York State in her current role as First Lady since her husband, our Governor, David Paterson, assumed office on March 5th of 2008. But she has a long history of work in health care and child obesity issues. Ms. Paterson has an MS in Health Services Management from the Milano Graduate School in New York City and a BA from Syracuse University. She has worked as the Director of Community and Government Affairs at North General Hospital in Harlem and as Director of External Affairs and Corporate Contributions for the Health Plan of New York, where she worked with community organizations, agencies, and corporations on issues such as healthcare and education. She currently serves as Director of Integrative Wellness at Emblem Health, where she works on healthy living and childhood obesity issues. In her capacity as our First Lady, Ms. Paterson has, in her usual warm and compassionate style, worked with organizations and schools to help raise community awareness of childhood obesity and its consequences. She spearheaded a statewide initiative called Healthy Steps to Albany, First Lady's Challenge. The program challenges middle school students to lead healthy lifestyles through exercise and healthy eating habits. The program encourages students to increase their physical activity by competing in a 6-week fitness competition. Madam Chair, I join with you, with my colleagues on the committee and my fellow New Yorkers by welcoming our leader in our state, our First Lady, Michele Page Paterson, here today, and I thank her for accepting our invitation.
Thank you, and welcome, Mrs. Paterson. Our next witness is Dr. Stallings. Dr. Stallings is the Director of Nutrition Center at Children's Hospital of Philadelphia and Professor of Pediatrics at the University of Pennsylvania School of Medicine. Her research interests include pediatric nutrition, evaluation of dietary intake and energy expedition, and nutrition and related chronic diseases. She joins us today to discuss her work as chair of the National Academy of Sciences Institute of Medicine's Committee on Nutrition Standards for Foods in Schools. Our next witness is Ms. Nancy Copperman, Director of Public Health Initiatives for the North Shore Long Island Jewish Hospital Healthcare System from my area of Long Island. She will discuss her work in an innovative program in my district called Activity Works. Activity Works is a school-based program which delivers physical activity right in the classroom. 5 school districts within my district are using this program, and from the feedback I have gotten from the children, they love it. Our next witness is Mr. Felton of the National School Boards Association. He will discuss what locals are doing to promote nutrition and also his thoughts on national nutrition standards. I yield to Ranking Member Platts for the introduction. I'm sorry. Ms. Platts is in the building, so we'll skip over and I'm sorry, Ms. Byrnes is in the building and she'll be up in a minute. Our final witness is Dr. Lorrene Ritchie, Director of Dr. Robert C. and Veronica Atkins Center for Weight and Health College of National Resources. She has worked for nearly a decade to promote the development of science-based solutions to the obesity epidemic in children and families. She will discuss her impressions of the WIC program and its role in reducing childhood obesity. I want to welcome all of our witnesses, and when Ms. Byrnes comes, we'll stop and have her be introduced. I know that you all have been told about the, for those that have not testified before Congress, let me explain our lighting system. When everybody will get 5 minutes, including the members, it's limited to 5 minutes of presentations and questions. The green light is illuminated when you begin to speak. When you see the yellow light, it means you have 1 minute remaining. When you see the red light, it means your time is expired and you need to conclude your testimony. Please be certain as you testify to turn on your and speak into the microphones in front of you. We will now hear from our first witness. Mrs. Paterson.
Good morning,
Morning.
and thank you, Congressman Tonko, for that warm welcome. I would like to also thank Subcommittee Chairwoman Carolyn McCarthy and Representatives Yvette Clark and Paul Tonko from the great state of New York, and the other members of the subcommittee for inviting me here today to present New York's efforts in fighting childhood obesity. As First Lady and in my professional career, I continue to be committed to promoting programs that protect and support the health of New York's children. Governor Paterson and I believe that all of us share a common obligation to ensure that our children have the opportunity to live healthy lives and are given the promise of a healthier future. But to have that healthier future, we need to address what is perhaps the biggest challenge to the health and well-being of our youth today, the obesity epidemic, which not only adversely affects children's health, but it threatens to shorten their lifespan. As all of you know, the obesity epidemic touches all ages, all neighborhoods, and all socioeconomic groups in New York State. 1 in 4 children is overweight or obese, and in low-income neighborhoods and neighborhoods of color, that number is as high as 1 in 3. Even though New York State has a strong requirement for physical education in our schools, the recommended 60 minutes of daily physical activity is not enough to ensure good health for our youth. The governor has proposed state legislation and programs to improve the nutrition of foods available in schools, reduce the availability of junk foods, and increase the opportunity for physical activity. He proposed again this year the Healthy Schools Act, which would require the establishment of nutrition standards for all food, school's lunch, school's breakfast, and outside food sold or served in schools. The governor also proposed and signed into law this year the Healthy Foods, Healthy Communities Initiative, which offers a new revolving loan fund to increase the number of healthy food markets in underserved communities. Additionally, our administration is working with schools, communities, and farmers to develop and expand the Farm to School program to promote the use of local fruits and vegetables in schools and to support edible school gardens. The governor's office collaborated with a wide group of partners and stakeholders in New York, including the YMCA and the Boys and Girls Club, to set model standards for nutrition, physical activity, and television and video game limits in after-school programs. And we have worked with our healthcare providers and more than 400 child day care centers to provide nutrition training, education, and guidance to staff and parents. For my part, I created a program called Healthy Steps to Albany, First Lady's Challenge. This challenges teams of middle school students, grades 6 through 8, are challenged to walk 4 million steps over a 6-week period. Everyday activities such as biking to school, taking a dance or karate class after school, or going for a family walk after dinner were compiled to help the classes get their steps to Albany. The Healthy Steps to Albany program is unique because students are asked to think about the many ways they can increase their daily physical activities. With the support of their teachers and friends, students are encouraged to turn off the TV, put down the video game controller, and be physically active. I chose to focus on middle school students for a number of reasons. It's at this age that many students are uncomfortable with their changing bodies because they're going through puberty. And students show that children's physical activities level, and studies show that children's physical activities levels decline significantly during middle school years. Today's youth spend an average of 32 hours per week in front of a TV, video game, or computer screen. This greatly exceeds the recommended limits of 1 to 2 hours maximum per day. Although I started Healthy Steps to Albany in Harlem before I became First Lady, this spring we expanded the challenge to 5 large cities upstate New York, in Buffalo, Rochester, Syracuse, Albany, and Yonkers. Nearly 270 classes registered, and the students walked more than 1.4 billion steps while mapping their progress across New York State. In addition, students had the opportunity to earn steps by making smart food choices. All the students benefited because the 13 classroom teams that walked the farthest earned a number of prizes, including a visit to a local organic farm where they learned how food is grown and prepared. Tomorrow, the governor and I will be in Buffalo to share a healthy lunch and present awards to the Buffalo and Rochester winners. When I took the students from Harlem to a farm last year, I realized how far our urban youth are from the sources of their food. One student told me she didn't realize that cheese came from cows. She just thought it came from the grocery store. Another student never made the connection between potatoes and potato chips. If students do not understand the origins of the food they eat every day, they cannot understand what they are putting into their bodies. Students learn not only in the classroom, but also in the cafeteria, the halls, the gym, the schoolyard, and their neighborhoods. They learn from teachers, parents, classmates, and neighbors. They learn what they see. And too often, in too many schools, students see high-calorie, low-nutrient foods and beverages. Today, more than 1,000 schools in New York have already implemented comprehensive wellness policies, enhanced nutrition standards, and increased the time of physical activity. I believe we can do better. We need federal legislation that raises the nutrition standards of all foods and beverages available in our school. Many of these standards can be addressed in the 2009 Child Nutrition Act reauthorization. We strongly support your efforts to request that the USDA strengthen by regulation the nutrition standards governing the federal national school lunch and school breakfast programs, as well as to impose stricter federal standards on competitive foods sold or served in schools. As you do so, be cognizant of how schools got into selling outside food in the first place. They had to compensate for the deficits caused by insufficient federal funding for the school lunch and breakfast programs. As you advocate for improving standards for school food, I ask you to also examine the cost to states to supply healthier foods. I am confident you will find that school food programs are severely underfunded. Improved federal nutrition standards and reimbursement for school lunch, school breakfast, and competitive foods, combined with programs to increase physical activity, will help children and adolescents establish healthy behaviors. In turn, students will be healthier, will have lower obesity rates, obesity-related diseases, and they will have lower health care costs. It can also contribute to increased capacity to learn, higher academic achievement, and greater success in school and their careers. We look forward to working with you on these important goals as the Child Nutrition Act reauthorization moves forward, and I thank you for your time and attention. Thank you.
Thank you, Mrs. Paterson. We're going to break our procedure and go and have Mr. Platts introduce our witness. We understand you were caught in traffic, so don't worry about it. Ms. Byrnes.
Thank you, Madam Chair. I am delighted to give introduction to our final panelist, Susie Byrnes, who's a great community leader in my hometown of York. Susie, welcome. And as those of you who saw her entrance and some of her props or the things she's brought with her, Susie brings an amazing level of energy to all she does. A registered nurse by training, since 1988, she's devoted herself to really trying to prevent the premature deaths caused by unhealthy lifestyle choices by developing the concept of and then following through on the creation of the Susie Byrnes Health Education Center, which officially opened its doors in 1995. After its first decade, the center continues to grow and reach its vision of becoming a leading resource of innovative, high-quality, effective health education. And I can tell you that I've had the pleasure of being at the center in my official capacity and to partner with the center in any way I can. But what was most informative, I've been there as a parent chaperoning my son's 6th grade class just recently for a wonderful program. And Susie, we are honored to have you here with us, and know that when we get to your testimony, you'll bring great insights as a leader in the area of health education centers, not just in York, but across the country with the National Association. So thanks for being with us.
And welcome. We have a vote going on, and we have to get over to the Capitol now to vote. We're going to have 4 or 5 votes, so unfortunately, we're probably going to be at least 45 minutes. So I think this is a good time for a break for everybody to stretch their legs, get something healthy to drink, and something healthy to eat, and we'll be back. Thank you.